In this podcast episode, hosts Alec and Jonathan Cohen engage in an extensive conversation with Dr. Ellen Langer, Harvard's pioneering female psychologist and author of The Mindful Body, Thinking Our Way to Chronic Health. They explore groundbreaking research and insights on the unity of mind and body, demonstrating how mindset, expectations, and mindfulness can profoundly influence physical health, chronic disease progression, and healing processes. The discussion challenges traditional dualistic views of mind and body, highlights remarkable scientific studies, and offers practical approaches for harnessing one's thinking to affect health outcomes positively. Dr. Langer begins by explaining her foundational concept of mind-body unity. Wherever you put your mind, you necessarily put your body. This principle emphasizes that mental states are not separate from physiological states, but inherently intertwined. Her early research in nursing homes revealed that when elderly residents were given agency to make even small decisions, their health improved and they lived longer. This finding laid the groundwork for understanding how feeling you matter and have control can trigger physiological changes and improve well-being. A key theme Dr. Langer stresses is that scientific medicine operates on probabilities rather than certainties. Diagnoses often present likelihoods, yet people tend to internalize them as absolute facts, which can prompt self-fulfilling prophecies, especially in terminal illness cases. She shares her personal experience with her mother's metastatic breast cancer mysteriously disappearing, defying medical predictions and underscoring how outcomes can defy probabilities. She argues that recognizing uncertainty invites openness to healing possibilities and can positively change health trajectories. Contrary to common associations with meditation, Dr. Langer defines mindfulness as the simple act of noticing new things, especially about familiar people and environments. This bottom-up mindfulness encourages fresh observation daily, which increases engagement and vitality. The top-down approach involves embracing the acceptance that everything is always changing, including perspectives and conditions. Both pathways foster presence and challenge mindlessness, automatic and rigid thinking that limits experience, health, and longevity. One of Dr. Langer's most famous experiments involved placing elderly men in a retreat retrofitted to resemble their lives 20 years earlier. Over less than a week, the participants demonstrated marked improvements in vision, hearing, memory, strength, and appearance, effectively aging in reverse. This powerful demonstration highlights the mind's capacity to influence aging and physical function through psychological and environmental cues. Studies with chambermaids showed that those informed their work counted as exercise experienced health benefits such as weight loss and lower blood pressure, while uninformed counterparts did not, despite identical physical activity. This underscores how attributing positive meaning to behaviors influences outcomes. Further experiments manipulating perceived time passage revealed that healing of wounds and cognitive functioning correlated more strongly with subjective time experience than clock time, illustrating the physiological impact of perception. Dr. Langer emphasizes how the words we use shape our health experiences. She questions medical terminology such as remission in cancer, suggesting that terms can cause unnecessary stress by implying fragility and constant threat. Instead, framing oneself as cured may align with healthier mindsets, reducing anxiety and fostering better quality of life. She also discusses the dual valence of personality traits, noting that negative labels like gullible have equally strong positive counterparts like trusting, and that shifting the narrative can improve relationships and self-view. Dr. Langer reviews remarkable placebo findings, such as clinical trials where sham knee surgeries produced recovery rates comparable to actual surgeries. Similarly, Parkinson's patients who underwent sham brain surgery with drilled holes showed symptom improvement lasting years. These experiments demonstrate the mind's extraordinary influence over physical health and the powerful healing potential residing in belief and expectation. The story of a patient whose tumors regressed after receiving a placebo drug but returned upon learning it was a placebo further illustrates this mind-body interplay. She advocates for patients' mindful attention to symptom variability rather than assuming constant decline or stability. Patients with chronic illnesses benefit from observing changes, asking why symptoms improve or worsen at different times, often uncovering emotional or environmental influences like stress. Such mindfulness fosters engagement, enhances self-awareness, and can contribute to symptom control and better illness management. Stress, Dr. Langer stresses, is primarily a product of interpretation rather than events themselves. People often suffer not because of events, but because of their rigid negative expectations about them. Mindfulness helps loosen these cognitive patterns by enabling alternative, positive, or neutral appraisals of adversity. By considering multiple possible outcomes and reframing fears, individuals can reduce stress and protect health. Dr. Langer critiques common absolutes ingrained by culture and science, such as horses don't eat meat or 1 + 1 = 2, demonstrating that context profoundly influences truth. This mindset unshackles individuals from limiting beliefs, inviting curiosity and adaptability, which are psychologically enlivening and promote wellness. While Dr. Langer does not explicitly frame her work as spiritual, she acknowledges that true presence and mindfulness, the essence of being spirited, require awareness and engagement with change. She differentiates mindlessness from spirituality, underscoring that spirituality must be accompanied by mindful presence to be genuine and beneficial. The conversation touches on the double-edged nature of medical labels. While they provide clarity and facilitate treatment, they can also confine identity and promote fatalism. Dr. Langer encourages moving beyond rigid identifications to embrace fluidity and possibility, which align with her broader thesis that perceptions shape health outcomes. Dr. Langer discusses how colors, smells, and other sensory inputs influence psychological and physiological responses. Medication colors are intentionally chosen, with antidepressants commonly yellow and antacids white, affecting patient expectations and efficacy. Environmental factors like team locker room colors also influence performance and mindset. The hosts and Dr. Langer suggest simple daily practices such as noticing 3 new things about your surroundings or people in your life to cultivate mindfulness. This practice nurtures openness, engagement, and flexibility in thinking, which are foundational to the psychosomatic improvements Dr. Langer documents. Dr. Langer highlights the importance of recognizing that scientific rigor produces probabilities, not dogmatic truths. She applauds the creativity required in scientific inquiry to investigate phenomena like spontaneous remission and placebo effects, which challenge prevailing biomedical paradigms. Embracing uncertainty supports resilience and self-healing. Expanding on her work with diabetes, Parkinson's, multiple sclerosis, and other chronic conditions, Dr. Langer shares evidence that a shift in perception and mindfulness can influence symptom severity, illness progression, and treatment outcomes. These findings hold potential for non-pharmacological adjunctive therapies, emphasizing psychological empowerment. Dr. Langer acknowledges biological limits, such as minimum healing times for injuries, but stresses that the range of what is possible far exceeds common assumptions. She encourages adopting a mindset of possibility rather than resignation to maximize health and vitality throughout life.